Good afternoon, everyone. I'm Dennis Clements. In addition to being a pediatrician, I'm a senior advisor to the Duke Global Health Institute, where I also teach and am a professor. I was on the search committee 10 years ago that selected Mike Merson as the Institute's first director, and I must say we did a pretty good job. Mike has done truly incredible work steering DGHI from a startup, for all you innovators, to the thriving, dynamic, well-established, multidisciplinary institute it is today. The first thing I did after Mike got here was I asked him for a job. Mike is joined on stage by two leaders who really need no introduction. Richard Brodhead, the 9th president of Duke University, and Eugene Washington, Chancellor for Health Affairs at Duke University. And Gene is also the president and CEO of the Duke University Health System. He must have a psychiatrist to handle that.
Yeah. Medication.
Yeah. Both of these individuals have shown remarkable leadership when it comes to embracing global health in all its iterations and potential. President Brodhead helped establish the vision for the Duke Global Health Institute a little more than a decade ago, and has been one of our strongest champions. In his introductory remarks when he first came here, he actually mentioned global health, and Honduras in particular, if I remember. And Dr. Washington, while a relative newcomer to Duke, has made global health one of the 5 pillars of the strategic plan for Duke Health. As we look toward the next decade, I know we are all eager to hear what these 3 leaders have to say about where global health fits in Duke's larger mission and the role we all play in the continued success of the Duke Global Health Institute. So what I'm going to do is ask them each a question and let them reply, and then the other 2 can also comment on the reply if they care to. So first, for Mike Merson, please describe the current state of global health broadly. What are some of the emerging issues and critical areas that researchers, practitioners, and academics consider to be the most pressing? And if there's time for you, how has the field evolved in the last decade? So basically, global health and its emerging...
Very simple question.
Yeah. I didn't make this question up.
Well, let me answer this way. First, you heard this morning the future of global health. I think the 3 sessions we had this morning beautifully summarized where the field is headed. We heard about the non-communicable diseases, which are most leading cause of death in the world: heart disease, cancer, diabetes, mental health. For me, smoking is the one we really need to get to. 10 million deaths by 2030 a year, and thousands of people smoking, hundreds of thousands, millions of people smoking more than they should. You heard about the global health security. We think of that as bioterrorism and natural disasters, but of course the emerging viruses, whether it be Zika or Ebola or SARS or HIV, this is really on the agenda, not going away for the future. The whole field of One Health, the intimate relationship between organisms, their environment, and vectors. There's the field which we heard today only barely touched the surface of climate change. The health consequences of climate change are going to be enormous. This past July was the hottest July on record in the world. Temperatures could go up 2.5 to 10 degrees Fahrenheit in the this century. We're just beginning to really understand the consequences of health consequences. Malaria, where we never saw it before, flooding, high temperatures, the Arctic no longer frozen. We're seeing so many new problems as a result of climate change. And then, of course, innovation in healthcare, very exciting field. We barely touched that this morning, whether it's drones delivering healthcare or mobile phones, nanotechnology. These are, to me, 4 big areas that in the future. Let me also say that we still have that unfinished agenda of AIDS, TB, and malaria. We have the unfinished agenda of under 5 child mortality, particularly neonatal mortality, which is half of under 5 mortality. We have maternal mortality, still a horrible, over 300,000 women dying each year from childbirth, pregnancy. The unfinished agenda has got to be finished. So added to that, we have the SDGs, which when we had the MDGs, it was simple. We could even memorize them. Now we have the SDGs, 17 of them, 169 targets. God knows that anyone can recite them. But they have changed our way of thinking. They're multidisciplinary. They involve many sectors in our governments and in our society to deal with them. And as we heard this morning from the first session, we need to think about financing. It's going to be a lot of domestic financing to meet these goals. It's not just the days of external aid are still going to be there for the poorest of the countries, but we must face now the reality of the middle-income countries that have a lot of diseases, as we heard this morning, having to figure out how they're going to take care of their populations. And the last thing I'd mention, Dennis, is global governance. We have an election coming up of a new head of the Global Fund. We have an election coming up of the new head of the World Health Organization. We have a new entity associated with the World Bank that hopefully will lead our efforts in maternal and child health, particularly women's health. And so there are great challenges ahead and for the field. What's so exciting is that it's changing as with economic development, but some of the old problems still need to be dealt with, and we can't forget them if we're going to have a healthy planet.
All right, thank you, Mike. Either of you, Gene, Dick, have comments on that, or want to ask him another question?
You think I'm going to offer to improve on Mike Merson's summary of the field of global health?
That was exactly
sure
what I
you
hoped you'd say.
Of course, we all have the format of the vice presidential debate on our mind. And so I was tempted to interrupt you continually.
That would be fun.
Dennis, I'm concerned if I ask Mike a question, he's going to really have a hard one for me when Mike.
Yeah, that's
But I actually do have a question.
yeah, preventive.
I think that the last area of challenge you mentioned is probably more significant than many people realize, and that's the one on governance.
Yeah.
And one of the problems that I've seen is that so much of what we've done relative to trying to improve health around the world has been compartmentalized. And it's either by disease or it's by some specific population. You just talked about women and children, which are critical, but not enough attention to working truly across sectors and across multiple stakeholders, and really getting at, those baseline determinants of health, almost like improving a platform on which you could build programs. So as you talk about governance, does it also mean looking at how we enhance the organization of our approach to improving health as well?
Yeah, and absolutely. And I think that was one of the big moves from the Millennium Development Goals to the Sustainable Development Goals. If one seriously looks at those goals, okay, there's only one, I think number 3, that has theoretically, that in principle has to do with health. But many of the goals have to do with health. And it's at the countries in particular where health has to become, as we heard actually from Gavin this morning, where health has to become everyone's business, not just the Ministry of Health. And at a global level, the last time I counted, there were something like 18 international organizations that actually were involved in health. And the real challenge we have with the WHO, that is not the strongest of the organizations, certainly, how do we find a way to engage the UN family, the international funds, to work together in a more harmonious way? This is a real challenge. Actually, Gene, my feeling is doing it at the global level may prove impossible. We may have a much better shot at doing it in countries, with the right leadership from the head of state, putting health where it needs to be. Certainly, we have similar challenges in our own country, but I you know those better than I do. But I think it's a really critical question where the leadership is going to come in health in the next few decades. That and I think it would be great. When I was in WHO 15, 20 years ago, it was a different world, and the leader of the World Health Organization really was the leader in health. Those days, I think, have passed us by.
Mm-hmm. Thank you.
Thank you all. For Dr. Brodhead, President Brodhead, what do these developments mean to an academic institution like Duke? I mean, why should, say, an English professor be interested in global health?
Well, I now know that part of the answer is, we all understand there are challenges in the world that no one is immune from. There are challenges that no one is rich enough to be immune from. It's the nature of environmental challenges and certain kinds of health challenges. But I'll answer your question literally about why should an English professor be interested in this. I started life as an English professor. After that, I was the dean in charge of all dimensions of undergraduate education and, in effect, the Faculty of Arts and Sciences. When I had that, so my field started far from global health. When I had my job as dean, I was at a university where everybody came with multiple achievement, placing out of college-level science classes. But as soon as they came, they announced that they had no interest in science, and you couldn't get anyone to take science anymore. So I led a self-criticism exercise, and what was discovered was everybody wanted to take science. People, in fact, loved science. They just didn't want to take the pre-med classes that were being taken for specific motives by specific people. And what they really wanted was they wanted a version of science where science wasn't disconnected. They wanted it to be connected to other things they were learning. They wanted it to be connected to things in the world. They wanted to be able to learn about the world as part of their education in science, and they wanted to learn how they could make a difference in the world. Now, very interestingly, I had a colleague at that very same time named Mike Merson, who was the dean of a school of public health, dying to find access to teaching undergraduates. But what you and I discovered was, although you had a population of people dying to learn this subject, and you had a dean dying to deliver that, you couldn't get the departments to make faculty appointments that would make this possible. After a while, you solve the problems you can solve, and the other ones you leave for someone else. I came to Duke. We ran a search in global health. Well, fast forward. I was reunited with my friend, and off it went. So I'd have to say, my own understanding of global health, I know a lot more about it than I used to. It gives me such pleasure to look out in this room and see people from so many different countries who I've met in my travels with Mike and others. But my personal commitment to it as an educator began with the idea that global health is the kind of thing that students want to learn about. It connects with the passions of curiosity, the passions to use your knowledge for the benefit of the world. And then I think everything we built here kind of grew from that. You mentioned it, Dennis. When you give an inaugural address at a university, you don't know what you're doing. So you can just say things about what's going to happen here. So I said this thing that this would be a fantastic university since it is a place that's very collaborative and very open to the interaction of academic research to real-world problem solving, that global health would be a perfect thing for Duke. About 2 weeks later, the provost Peter Lang and the then Chancellor Victor Zhao said, "Well, when are we going to do this?" Well, what do you mean? I mean, typically education and academic administration means how to keep people from realizing that it's never going to happen. So they each put up out of their own reserves very significant financial contributions. We had a task force put in place. You can still look at the plan that was drawn up because it still is basically the outlines. There were going to be 3 parts: an educational dimension, a research dimension, and then the part that I learned a phrase at that time, the effector arm, the idea that you'd be connected with actual partners where you would be able to put education and research together with people working in real places. I'm looking at our friends from Kilimanjaro Christian Medical Center. This was, of course, and John Bartlett, this was de facto one of our first effector arms. And so how you put those pieces together, for me, the story of global health at Duke is the story of Jack and the Magic Beanstalk. There's this, somebody gave you a seed and you drop it in the ground and then you go to sleep and you wake up and it has grown this gigantic plant. I mean, this is the way this has worked here. This university, it proved that the university was receptive to global health, that instead of it being the case that no one wanted to play that game, as soon as Mike and you and others began playing the game, everyone said, I want to join, right? And actually that really has been the basis of the success of the program at Duke.
Yeah, thank you. You described the interactive, the interdisciplinary nature of all of this right from the beginning, which is, I think, phenomenal.
Well, it had two things, because it was about the interconnection of domains of knowledge, that's interdisciplinarity, but it was also about the interconnection of knowledge and the world, right? And the health of men and women in the world, which has always been the passion that has driven the pursuit of knowledge by people who take these classes.
I would add, Dick, that the thing that struck me when I arrived was that the name of the strategic plan for Duke when I arrived was Making a Difference. And I didn't know many universities that had that as its title for a strategic plan. Think about that, making a difference, not just knowledge for knowledge's sake. And I think that was a real driving force and is very well summarizes what Duke is all about.
Gene, do you have any comments from that?
Yes, I would just add to Dick's analogy about, the seed in the ground. Even with a pluripotent seed, it still needs nurturing. It still needs to be developed. And so I want you all to join me in a round of applause for these two leaders who, in fact, not only planted the seed, but nurtured this highly successful endeavor over the last 10 years.
Well, and you continue to supply some vital nutrients.
Well said.
We didn't realize when President Brodhead came, it was a 2-for-1 package, but now that we know that, good. For Dr. Washington, why have you made global health one of your 5 strategic priorities for Duke Health?
Yeah. Well, first I want to say, I since they put this fancy mic on, it's supposed to be that you can't see it. So I have a very fancy mic on, the same one that Usher wears or John Legend. And I keep wanting to jump up and sing or dance, and I can't do either one of them well. So it would be quite comfortable.
Don't let it impede you.
Yeah. But most of you know that earlier in the year, really with the input from many in this room, and certainly Mike in his leadership role, we transitioned from Duke Medicine to Duke Health. And that was more than symbolic, although it was symbolic also, in that we wanted to really tell the world that we saw the ultimate outcome of all of our work as improving health. We continue to believe that advancing research is a critical pillar of our mission. Educating future generations of health leaders is a critical pillar. And obviously providing highest quality patient-centered care is also one. But increasingly, across the leadership of Duke Health, we had come to realize that those were a means to an end, and that the ultimate mission was improving the health of populations. And in embracing that mission, it wasn't difficult to just take the next step of realizing improving the health of populations for us meant improving the health of populations locally, nationally, and really around the world. And so it emerged early on as the overall mission, recognizing that we would do that together with other sectors, and hence the mission statement, advancing health together. So in that context, Dennis, global health became a part of, in fact, really in many regards, became the mission of Duke Health. So that would be one. We embrace it because it's our mission. Two is, in a somewhat self-serving regard, we embrace it because we benefit from it tremendously. You know, some of you know I trained in what in those days were called international health. Had a career in the public health service, worked at the Centers for Disease Control for almost a decade. In fact, I first met Mike years ago when he was still based at WHO. And what you saw early on in those days, we used to think of it as kind of a one-way street where we were providing technical assistance and we were taking knowledge into countries. And we soon realized we were just missing a huge opportunity. It really is a bilateral exchange, and that is certainly what I've seen in our programs across Duke University related to our activities in global health, locally and really around the world. We see it in the form of our students who come back, who see a different way of providing care or thinking about education. We see in those same students a deeper empathy that they then share with their classmates. We see it at the level of our staff who work in these programs and come back and interact with staff who have some novel approach for how we dispense medicine or how we communicate with patients, recognizing in some of those settings that are resource constraints, we don't need all the high-powered technology, and they come back challenging some of our modalities in a manner that leads to actually better value in the care that we provide. And we certainly see it in our faculty who spend time around the world. You know, when I spend time at Duke NUS, for example, and I see one of our faculty members right here in front of me, and we're exchanging ideas, one of my questions is, okay, well, how do we ensure that this exchange of the knowledge that's being generated here is disseminated around the world, and certainly in a manner that we at Duke or position
rather than an imitated version of somebody else. And it seems to me that global health is part of the forging of the recent identity of this university. You know, there are universities that have some kinds of things and they don't have other kinds of things. There may be things we don't have at Duke, but I'll tell you, global health is an example of the kind of thing you have, and I can give you all the other examples. You know these. So this is the health version of what we would call in the environmental realm something like the Duke NEEPS, the Nicholas Institute of Environmental Policy Solutions. The engineering school is defined by the fact that it has this kind of problem-solving, go out in the world kind of basis to it. So it's really, it seems to me, whoever comes here is going to come attracted by that element and with every intention of supporting it. So I see global health as becoming nothing but more and more important in the identity and the service of this university in the future.
So I'm the other one that's stepping down. I'm not leaving Duke, but I am stepping down from this position. I have, similar to Dick, I would say, Bill and others, that the Institute is in a wonderful position because of the leadership of this university that are sitting here, those that have come and gone, and also Sally Kornbluth, who will be here this afternoon, the current provost. It's a university institute. All the schools own us. None of the schools own us. It's a wonderful relationship. We are truly interdisciplinary. And we have that luxury of being able to turn to the leadership of the university when we've really had a good idea. We've always gotten support for it. The college major we have now, my gosh, can you imagine, as Dick mentioned, in 3 years you have 300 students in a college major or minor? I mean, that wouldn't happen anywhere, but it happened because of enormous support from the provost and the dean of arts and sciences. The other point I'd make is, since I came, I mean, people say money is important. Yes, money is important, but not as important as the support that you get from leadership and also the faculty. Look, at a university, if I've learned anything in over 20 years in academia, the only thing that is the most important thing is the faculty, the quality of the faculty and the commitment of the faculty. And what we've built up in the Institute, first of all, the Institute has brought 58 faculty to Duke who weren't here 10 years ago. Right. That's a remarkable number. So why did they come is the interesting question. And when I've talked to them, and they've been honest. What appealed to them by the Institute is that it was a place where people came together around common problem, which is the world's health and the gross disparities and poverty that we see around the world, and how we were going to alleviate those. That's not going away. And that to me is the ultimate fiber of the Institute. Yes, a new leader will come, and it will be important to have support continue from the leadership of the university. But it's the fabric of our institute that brings us together from across so many different parts of Duke that gives me optimism for the future.
Well, because after all, if you had any interest in running a global health program, might you not wish to run the one here? At a place where the whole institution is so favorable to it, sees its identity as embodied in it. So I'd have to say, we went forward in our last search with the idea that if we could find the highest level of talent, we'd be able to get that person, and I would go into the next search with exactly the same supposition. While acknowledging that there is no second Mike.
That's fine. I'm sure there is.
Then during this period of renewal, as we think of it, there's yet another position that has influence on global health, and that is Dean of the School of Medicine. And Mike and I have had a conversation about that, and Mike, being, anxious as he can be sometimes, said, Gene, how are we going to ensure that this person really is supportive of global health? And I just say, Mike, at the end of the day, in consultation with Dick, I make the appointment. So do you think there's any doubt that this person is not going to be?
I mean, it's funny. Sometimes people, really smart people, fail to think of the simplest answers to the simplest question. How can you be sure that the person you'll hire will be X, Y, and Z? Well, you select for it.
And so for those
the
of
answer
you,
was fine with me.
but nevertheless, to reassure Mike, in the job description, Mike, there's a paragraph on how the dean will work with the Institute Global Health, will work with Duke and US, and other collaborators at Duke to advance global health.
But I got to play a part in the hiring of this fellow and of this fellow. But the whole point is, your interest in coming here was your interest in coming to a place that was much more widely collaborative. So that's to say, it was not the resources of the health system that attracted you. You were already at a place that had about the same as those. It was the potential resources embodied in the broad potential for collaboration.
I'll see.
Thank you. Dr. Horton. Can someone get the microphone?
Since you don't know, Richard, you may want to pretend your mic is not.
I have a theory as to who he might be.
So my name is Richard.
So mine as well.
Good to meet you. I come from a very small country a long way away, which has an identity crisis. Sometimes we call ourselves the United Kingdom, but we're clearly very disunited. Some of us call ourselves Great Britain, but we lost our greatness many centuries ago. And recently we voted to leave the European Union.
I was there that day.
Which reflects a trauma that many of us have not recovered from. But those of us on the other side of the ocean have noticed that you have your own interesting moment in your nation's history. And we'll see whether Donald Trump does become the President of the United States. But I'd like to ask you, as you're going through a similar moment where clearly there's a large proportion of your population, close to half, who feel dispossessed, alienated, disenfranchised, angry at the political direction of your country, just as in ours. What is the role of a great university like Duke in building social solidarity, greater equity between people, and creating a space for a political conversation that isn't dominated by Miss Universe?
I think that's for you.
If I had...
I know that's for you.
I was far more enthusiastic about having questions from the floor than they were of the Billy Pan sort. Well, come on, let's be frank. You and I live in democracies. It was not just every day in history that countries had many of the benefits we take for granted in these countries, and people can feel dispossessed and alienated in countries in which they nevertheless take for granted very high standards of security, even health, even social security by any historical standards. The causes of the problems that many countries share nowadays are complicated ones. There are problems that have to do with economic dislocation, but actually even in the Depression, you had much more severe economic dislocations that produced a different kind of atmosphere. And I'd have to say, one of the things that's quite striking in this country in my adult lifehood is the lack of agencies or powers putting forward the idea of things that hold people together. We've all learned how to be suspicious of collective identities without understanding what a price we would pay when we lost the sense of collective identities, right? And it seems to me that we see this at many levels in this country. The business of taxes. No one likes to pay taxes, but there was an idea that there's something that's the commonwealth that we all benefit from, and so you don't look to see, I'm just going to pay the bit of it that I get my benefit from. Nowadays, in this state or most states in the United States, people don't want to pay for the citizens of that state to get education at public universities. Actually, it used to be very cheap to go to public universities because the taxpayers paid for everybody. Not their own children, but everybody's children, because there was a benefit that came from investing that way. The loss of that idea is a very, very challenging proposition at a time when you have open borders, when you have open trade and all the things that are so hard to explain and so easy to misunderstand. What's the role of a university? I'd have to say, I love this university. I'm very proud of it, but I am not a megalomaniac of universities. I don't believe that single universities or even small groups of universities have the power as agents to solve the main problems of the world. Let's think of global health. No university ever eliminated a major disease. No university ever eliminated maternal mortality in a country. But a university has a specific form of agency that not just everything has. That's to say, they can sponsor research and the power of ideas that goes far beyond any power the university could wield, and they give people education. I'd have to say, the notion that, we had 32,000, you came here, you have to endure a little of this. We had 32,000 applicants last year for 1,600 undergraduate slots. So you've got very talented students, but as soon as they get here, they realize that global health is the coolest thing on campus. And this means that everybody knows something about global health when they graduate, and many people find their calling in this direction when they're here. That's the way universities really wield their power, is by giving people the bent of their life, giving people a sense of how would it be valuable to acquire your education and to use your education over the course of your life. That's the way we really do it.
Other comments?
No more like that, Dennis.
I have a question about the interdisciplinary nature of the Global Health Institute. It's obviously been collaborative for university and the medical side. Why is that possible here? In a lot of other places it isn't.
I would say there's at least from the time I've been here, there's a long-standing culture of interdisciplinarity, which I understand goes back a few decades now. Dick may say more. And it was part of the culture of Duke for a while. Previous presidents and provosts, certainly chancellors, promoted that. That's the first thing I'd say. Secondly, the geography of the university. I can walk pretty much anywhere from my office in 10 to 15 minutes, a little bit longer to the East Campus. So, but I would say that helps a great deal. And thirdly, there is a flexibility in the way faculty are allowed to work. Having been to the Northeast, the one place I was at, you needed a visa to go from school to school. and that you certainly don't get that feeling here. There is a warmth and a reception that faculty can have 2 appointments, 3 appointments. When they go up for promotion, I get asked if they're in their school to give a letter to say what are their attributes for being promoted. So I think those are the reasons that immediately come to mind. And I think also perhaps in hiring of the deans of the schools, the leadership of the university have been very good at identifying deans who don't want to build silos, but really do see the advantage of having the culture of Duke as something they want to take advantage in leading their schools.
I'll just add one other thing, which is paradoxically, Duke has always had the advantage that it's quite well resourced compared to many universities, but actually not well resourced compared to some other universities. And thus, people in leadership positions here have had to scramble and scrounge and do things to make things happen in a way that isn't true if you sit on top of a big pot of endowment. It interests me, if you're going to look at, to me, the historically first great example of interdisciplinary culture, the fact that biomedical engineering was practically founded at Duke. Right? But why? Because two people saw they could accomplish something together that neither of them could accomplish by themselves. That doesn't keep people from failing to collaborate elsewhere, but here there was just an incentive. You could actually get somewhere if you did it. The Sanford Institute is, for me, just another classic example of putting together public policy, economics, statistics, civics, ethics, all kinds of things that would be completely separated in the rest of the curriculum.
How many places, Gene, can you walk out of the medical school and look at the center of the campus? Not many.
Not many. Yeah.
All right. Any last questions from the audience?
You suggested a question before we started, and if there's a minute, I'll ask it of my colleagues, which is, if we came back 10 years from now, what would we expect to see here?
You're asking?
Yeah,
Oh.
just for instance.
Yeah. You go first.
Miguel, sure. I think I hope we will build on, first and foremost, what we have. I think it's terribly important. We heard this morning about all these new programs. I hope they'll be stronger and start to do new things, but not lose their core. That, to me, is going to be very important. You go through a phase of building, and now what we have to be careful is not to keep building without really consolidating what we do. So we heard today, yes, we should be doing more in the education front. We talked about an accelerated master's program. We talked about more online education. We talked about more links to our new university in China. We talked of various ways in which we can take, we all want to build our doctoral program, our doctoral scholars program. We heard today the things that we want to do more of, and I think that's great. I think on the research side, we've got 7 research areas, some more developed than others. We need to look at where the needs are and continue to grow those needs and where there are opportunities. Think how far you heard this morning, how far we've come in global mental health, how much we've done in the environment. Certainly, we didn't talk this morning, but there's a huge growth in women's health and also particularly around cervical cancer and other emerging problems particularly in Africa. So I think that for me, I would hope to see an institute that has its current fabric, but is grown in ways that are cutting edge and aware of the needs that are there and responding to them. Certainly, as the field of innovation, whether we talk about in education or in research, is endless. And how we explore that area, you'll hear this afternoon about a new center the Institute is opening in the area of global health innovation. This is, to me, we need to be strategic and continue to see ourselves as a bridge between the various parts of the university. I think having Gene and Sally as a new chancellor, a new provost, is going to be assurance that that's going to happen. So, to me, that's what we'll see.
That's great. Real quickly, when you come back in 10 years, first, you should expect to see me. Beyond that.
Him and all the cool programs.
But no, I was going to pick up on what Mike, because I was just sitting here thinking. In 10 years, I do think that we will have even more of an emphasis and more advances in the area of innovation as it relates to global health. And in particular, I think that we will have a different set of partners than what we have now. And that as we think about global health, in the way that we're beginning to partner now with Google and Apple and Microsoft and IBM, nationally, we will be thinking of those as our everyday partners in the same way we think about AID or CDC or the World Bank Organization 10 years from now, with an eye toward how do we leverage the partnerships, the technologies and innovations that they bring to the table, again, to help us fulfill our mission of improving the health of populations.
I would just add one thing, Dennis. I'm very honored to be on a committee of the National Academy of Medicine that is looking at the question of global health and the future of the United States. And we've only begun our work, but it's very clear that the future of the United States very much depends on having a strong commitment to global health. And I have to believe that Duke, we don't rank ourselves, but that Duke will continue to be a leader in this area.
All right. Good. Thank you very much, gentlemen.
Good. Thank you, Mike.